Hi everyone, I'm Png Hui Jun. I'm an occupational therapist working in KK Women's and Children's Hospital.
My name is Cheryl Lee. I've been working in St. Luke's Hospital as an occupational therapist since 2016.
My journey as an OT began when I was looking for a career option after JC. So one of my older brother's JC friends was starting to be an OT at that point of time, and she introduced this career to me, and I was looking for a job that I could potentially help people in. And this journey really began when I applied for a healthcare scholarship. I got accepted into it, and I also got accepted into the university of my choice.
My passion for healthcare actually started because I had lots of support from the healthcare workers in the hospital because my family, my mother and my brother were ill. So they would spend lots of time in the hospital. So these people supported me and I wanted to give back. I wanted to do the same. So I actually looked for a job that I could find opportunities to give back and make a difference to people's lives. So somehow life led me to OT.
At KKH, I work as an OT. I work with babies, teenagers and children all the way from 0 to 16 years of age. I enjoy the dynamic nature of the acute setting. It can be challenging at times with the daily crunch of the setting, but at the same time I enjoy learning, and I think it's a great opportunity for me to experience every day. My role as an OT varies from day to day depending on the patients that I see. One of the key roles that I hold is to actually assess my patients' functioning level, whether they are able to do self-care skills or activities that they used to do day to day. I may first assess that by talking to their caregivers to see what they are currently able to do at this point of time. I would then have to analyse whether any of these areas are affecting their ability to perform daily activities such as dressing, toileting, showering, feeding. I will also then carry out interventions to work on these targeted areas of difficulty. I will use interventions through games, fine motor activities and tabletop activities. One of the other roles that I have is to work closely with the patient's caregivers to ensure that they are able to return smoothly back home. I may prescribe equipment for them and also work out their home's setup so that it is suitable for discharge back home. Before discharge, I will also teach caregivers and patients themselves on some of the suitable activities that they can do at home that can still continue to work on those identified areas of difficulties.
Nice.
When I was in school, I had an opportunity to explore various care sectors, and I realized that I fell in love with the community care sector. Because in the community care sector, I get to spend a longer time with my patients. So that gave me a longer time to interact with them, get to know them better, and also more opportunities for me to make a difference in their lives. As an OT in community care, what we do is we help our patients get back to doing the activities of daily living that are meaningful and important to them. So things like, for example, getting into a taxi to go and meet their friends or go to the market to buy groceries, or even just functioning at home like cooking for my family or looking after my children. I also spend some time in my patient's home together with them. We will practice their activities of daily living, such as getting in and out of the toilet or getting in and out of their bed. Also, I work with the caregivers to help them and teach them how to manage and cope with the care of the elderly, to keep the elderly safe, at the same time to help them reduce their caregiver burden. For me, I believe that as an OT, when a patient leaves the hospital and goes home, my job doesn't stop there. For me, I feel that I, as an OT, when they come in to see me here in the inpatient, my job is to also think in the long run for them. So when they are going out in the community, it's not just home, there's also that social circle of friends. So it's really about that journey of in the community, how they navigate their physical, their social space, their environments, so that they can continue to live that kind of meaningful and more fulfilling life as a person.
I think that being an occupational therapist comes with a set of unique challenges. It varies from every experience that we have and every person that we meet. But at the same time, it is a very fulfilling career. I would say that never lose the passion to help others and never forget why we enter this profession in the first place. Yeah.
To all aspiring OTs out there, every client that crosses your path is an opportunity to make a difference. Seize it.